Hi everyone. So I chose the article based on terminal cancer. Um, it's called Transmural Cancer: A New Approach in the Care for Terminal Cancer Patients and Its Effects on Rehospitalization and Quality of Life. This one caught my attention because it's cancer is a common topic for us in the healthcare field, and most of the patients in my facilities, majority of them, they have cancer. We have a few of them with terminal cancer in hospice. So I really like this idea because it's something different to what I've known so far in the field. So the article is basically an experiment of a new idea for patients that are in terminal cancer, so they don't go back to rehospitalization. It's really interesting. So the study purpose and design for this article is to randomize a trial to examine the effectiveness of hospital to home transition care programs. So in order to be able to provide better supportive care for these patients at home, an intervention program was developed. Its main objective was to offer the patient's care especially tailored to meet his individual's need, and provided by professionals caregivers from primary and hospital teams. So this study was an experiment in Netherlands, based for terminal cancer patients that are also most of the time rehospitalized. So to avoid this, they come up with this experiment. So the intervention for the experiment is nurse lead intervention focusing on the transition from hospital to home and supportive care for self-management. So in the intervention, the group of the primary care team continued to care for the patients as usual, just like a regular hospice, but with the collaborative support from the hospital care team. The intervention intended to optimize care by improving continuity of care and by emphasizing the complementary approach to caregiving with a maximal coordination and communication. So these things are not usually in a hospice environment. This kind of care was named Transmural care in Netherlands. So okay. So the study, like I mentioned, the population setting was for patients hospitalized for heart failure transitioning to home care. So patients with terminal cancer that would transition to hospice. So the study, the purpose is for patients not to return to the hospital and for them to have a what we can call a good death. So and with a better attention, more human. So the systems element for this one, it was nursing transfer letter to the home care nurses detailing patient's clinical status. That was the first step. Hospital to home transitioning program to increase coordination of care to improve the method of process of discharge care and heart failure patients. And then continue relationship with the nurse after discharge. So this is what the program have extra. So phone outreach call by hospital nurse to patient within 24 hours of discharge home, improve communication with patients and family. So the process for this was the intervention program. Um, it has a specialist nurse coordinator, a 24-hour telephone service in the hospital with access to Transmural home team, in a collaborative with the home care desserts and protocols. And then the specifically nurse coordinator. So the specialist nurse coordinator is the key person in this intervention. On the request of the treating specialist, the prepares the necessary patient discharge arrangements, like I mentioned. And then the 24-hour telephone service, a 24-hour telephone consultation service was installed in the hospital and oncology, and this service is mandated by the nurse from the ward. In order to do so, they were specially trained in giving assistance to the patients by telephone. In case of problems arising at home, this service can be contacted for advice. It can be reached day and night, like 24 hours, and by telephone via a direct line, so there's no operators and there's no delays on interference. If medical questions arise, a specialist consultant can be contacted using the service in order to give the adequate advice, and a copy of the patient's home care containing all of the essential medical and nursing information is at hand. So this 24 hours service is, the best. And then the major outcome here was, like I mentioned, avoiding the rehospitalization for the patient and helping them have a good death. So the major outcome variable examined the disease specific quality of life. That's what they examine. The generic quality of life rates of hospital readmissions. So the study to see how this experiment worked. And then the emergency room use, obviously, because the more they come back, the more use for the emergency room. And then the outcomes measure for the experiments are the result. Patients in the intervention group show significantly lower levels of rehospitalization during the terminal phases of their illness compared to those patients in the control group. In the subgroup, the patients in which the effect of intervention on the patient quality of life could be evaluated, the same difference in rehospitalization between the intervention and control group was observed. No significant confounders could be identified for this outcome measure. So therefore, they confine themselves to on a variable comparison. And a little extra I want to add to the knowledge. This study was finalized, supported by the National Committee of Chronic Disease in Netherlands, and a scientific fund of Catharina Hospital, and then the support of the local organization for general practice, pharmacists, home nursing, home family aides, volunteers, and medical and nursing staff of the Catharina Hospital. Okay, so the results of the study I already mentioned, that's what I was saying. And now my one and unique recommendation for the article. It may sound maybe we can take it as a little personal, but I believe it's also a professional way. There's many ways to show our patients that we care about them, that we support them. It's very important for someone that is at the end of life to feel they have support from the caregivers. So that's my recommendation is this, and a little bit that I want to add up is death can be frightening, and this can be especially true for patients in terminal stages of chronic disease, like terminal cancer in this case. These patients often wish a good death, like I mentioned, and I believe this experiment do just that. I agree, this experiment provides just that for the patient. Okay, so, and like I said, this experiment provides the patients with the comfort of knowing, that they won't die alone or in pain or abandoned by their caregivers. However, my one unique recommendation for the study of intervention for this experiment is to tell the patient you care for them. Even if you believe that they don't have the energy to respond to the message, it will mean a lot. So as professionals, we always have to, show empathy, like I always say in all my videos. Show empathy and care for them. Not only, it's not only about the medicine, it's not only about, it's a little bit more than that. And I believe that makes a lot of difference in the care that we give to our patients. So guys, thank you for a wonderful semester, and I wish everyone good luck. Thank you.